Hi, I'm Maria from Dental Designs Clinic, and I'm going to talk a little bit about when someone might need a full mouth rehabilitation treatment. So one of the things that we look at when a patient comes into the clinic is the overall condition of their teeth. And one of the things that we often look for is whether or not there's wear on the teeth and whether there's loss of tooth structure that's either due to decay or problems with the bite and things like that. So I'm just going to show a couple of cases where patients have needed a full mouth rehabilitation treatment. So the first one here, we can see this particular patient had very generalized wear and also some areas of decay. And when you look at the teeth, you can see that, for example, this tooth right here, the middle of it looks quite yellow, and that's because this patient has actually worn through the entirety of the enamel in the middle of that tooth and is only left with the second layer of the tooth. The bite in this case is also quite collapsed, and this patient was very unhappy with the aesthetics. So one of the things that you can do to treat this is to reestablish the bite. And we do that in a variety of ways. We test out a different bite for the patient. First, we do a digital smile design with the lab, and we take scans to help us figure out where the new bite should be. And we make sure that the patient is happy. So the most important thing is to know where you're going before you get there. So everything is planned ahead of time digitally before we ever touch the tooth. The second case that I'm going to show you is a very similar situation where this is a patient that had quite a bit of decay, a lot of wear, and some old restorations that were failing. A lot of the teeth were very sensitive, and the bite was also collapsed. You can see, especially on these lower teeth here, all of the molars, and you can see the areas where you have those little notches where you have wear on the tooth. So the first two cases that I just showed you, the previous one and this one, are cases where I think one of the major contributors could be, acid reflux. This particular patient had a history of gastroesophageal reflux, and that can contribute to a lot of acid production in the mouth. So it's really a comprehensive treatment where we look at the whole person and we kind of figure out what is the cause of what's happening. So it's probably a combination of wear in this case mixed with the acid reflux. But the final case that I'm going to show you is a situation where, unfortunately, this patient had a lot of dental work that was old and not holding up super well, and there was a lot of decay. Some of these teeth were not savable. There was a lot of decay under some of these bridges, and aesthetically, she was very unhappy. So this is another situation where, even though the bite is normal, or she doesn't have loss of height in the bite, she still needed a full mouth rehabilitation treatment. So this is something that needs to be assessed on a very individual basis. But one of the things that you can look for as a patient is whether or not you have a history of tooth grinding or acid erosion or a lot of decay, or you feel like your face is starting to look like it's collapsing. And you can ask your dentist about that, and maybe they can help you with, planning out a treatment that can restore function. Thanks for your time.